Welcome to my channel. This is Bruce the Boss, and today's topic is how doomsday is amongst those here in the United States of America as Social Security and Medicare are set to go bankrupt in just a matter of years. But before we get into that, if you're not yet subscribed to my channel, which my analytics show a good 90% of those who have been viewing my channel, my new channel, since I had to restart since YouTube nuked my previous, are mostly unsubscribed. And I do want to say thank you to all those viewing this brand new channel, over 10,000 plus. But it's showing over 90% or so are not yet subscribed. So please go ahead and smash on that subscription button. Like this video, comment on this video. Your interactions go a long way with helping this beat the YouTube algorithm, which is designed to suppress any and all alternative sources of information and or narratives that contradict the official narrative. And also don't forget to smash on that subscribe button and make sure you're checking that if you are yet subscribed so you don't miss any of my latest content, as I try to keep everyone, whether you're here in the United States, the UK, and I've been making a lot of special shout outs to Australians and my Aussies. Don't miss some of my content as I try to keep you informed on what's going on around the world and likely in your neck of the woods, so you can make necessary preparations and or peep what's going on and make the necessary moves. And always check that notification bell, as I have been getting reports from a lot of my new subscribers on my new channel here that they are not getting notified, despite the fact that I'm posting a couple of videos every single week. So if you're not getting notifications and you are subscribed, make sure you are routinely checking my channel, because YouTube's doing a lot to try to suppress. So that, I digress. Now let's get into the story, which, by the way, I will include a link of this article in the description box below. So be sure to check that out if you want to read it for yourself. But I'm about to go into it with you. Let's roll. So according to CNBC's article released Tuesday, August the 31st, 2021, Social Security Trust Fund now projected to run out of money sooner than expected. Well, what do you know? Due to COVID, the Treasury says. So reading through here. All right, so the Social Security Trust Fund most Americans rely on for their retirement is set to run out of money in exactly 12 years, 2033. The outlook, aggravated by the COVID pandemic, also threatens to shrink retirement payments and increase health care costs for older Americans. We'll get into why that is exactly soon enough. So the Treasury Department, which oversees two Social Security funds, the Old Age and Survivors Insurance and the Disability Insurance Trust Funds. So those programs are designated to provide a source of income, respectively, to former workers who have either retired at the end of their careers or who cannot work due to disability. Now, it's stated that the official said that the Old Age and Survivors Trust Fund is now able to pay scheduled benefits only up until, as it stands right now, projected 2033, 1 year earlier than reported last year, which would have been 2034, was the projection. Still bleak. The Disability Insurance Fund, however, is estimated to adequately pay out its benefits to those who are disabled all the way up until 2057. Now, those two funds are completely separate right now, but they have mentioned here that there is a hypothetical proposition of what if they were to combine the two funds. But even if they do that, it's only going to extend it by 1 more year, as they'll be able to pay scheduled benefits on a timely basis only until 2034. Again, really just the extension of 1 year, even with the combination of the Disability Fund and the Old Age and Survivors Trust Fund. All right, now going on. Now, the Treasury Department said it is estimates that the levels of worker productivity and thus GDP is assumed to permanently be lowered by 1%, even as the projected is set to resume pre-pandemic trajectories. No kidding, you freaked the American population out to death over a virus that has a 99.99997% survival rate for the overwhelming majority of individuals, and even for those who are elderly, with the survival rate slightly decreasing, but you're still talking about over 99.1% for most people in their 50s and up. Yes, it goes up to about maybe 96% survival rate and change for those in their 70s and over. Although those in their 60s plus, it's still looking good, about 97, 98% survival rate for those in their 60s. But you freak a lot of these people out, of course, there's going to be worker suppression, people too scared to leave their homes and to go out and work. You set the table. There's the results. Nevertheless, the financial outlook for Social Security and Medicare, two of the nation's preeminent safety net programs, have deteriorated over the past year as COVID hastened retirements. Again, and caused a contraction in the size of the U.S. labor force. Again, you freak people out about going outside, doing normal activities, being surrounded by people. You shut businesses down. In fact, destroyed many businesses, forced people to go at home, forced businesses to shutter their doors permanently. You forced their capacity limits, forcing workers to be cut, hours cut, things like that. Of course, it's like, what's the point? I can make just as much money staying home on this beautiful unemployment benefits that the federal government kicked in an extra $300 to the states to help pay people on average about $16 an hour. So, of course. So no one's really paying into these programs. On top of that, there was no change from last year's projections that the Medicare's hospital insurance fund would be depleted in 2026. This is another big point that kind of got lost in the headlines. Medicare hospital insurance, that's essentially Medicare Part A. So you have four parts of Medicare. You have Medicare Part A, which is your hospital insurance, anything, and not outpatient surgery. I'm talking about inpatient hospital stays, inpatient skilled nursing stays, and hospice. All right, that's set to run out in about 5 years from now. Less than that, actually. 2021 is almost over, so we're talking about just a little over 4.25 years from now. Medicare Part A is set to deplete. At that point, doctors, hospitals, and nursing homes would not receive their full compensation from Medicare, and patients would likely bear the added responsibility for any cuts to their coverage. Let me go on here. But the future of this model is now in the middle of a slow-moving crisis. No kidding. Again, Social Security payments are about to run out in exactly 12 years. And then you have Medicare Part A benefits running out in about 4 years now. So, no blank, Sherlock. In other words, Social Security's costs in the form of monthly payments to retirees now exceed the income it takes in from U.S. workers. Again, you have more people forced out of the working environment, and that's not to even take into account the fact that Social Security as a model only worked because of the baby boomer generation, the largest birth rate and increase in this nation had ever seen in its recorded history. Problem is, those same baby boomers that were perfect to provide payment and Social Security or a safety net for their parents at that time, because children who were baby boomers entering the workforce, there was about 4 to 9 workers for every retiree of the pay towards those of the greatest generation. That those same people where there was a surplus to pay for each individual person who was now retiring from the greatest generation and previous generation did not, I guess you can say, procreate at the same rate to see their numbers then double. Instead, it was a shrinkage. So you combine the shrinkage of millennials and those in Generation X deciding not to have families in conjunction with the forced shrinkage of the economy. Again, so no kidding. So projected to soon consistently operate in the red, the program's reserves fund would be depleted around 2033. So if Congress doesn't act by that time, which I don't know what you can really do, Social Security law would cut benefit checks to retirees by about 20% across the board for a demographic that has planned on those payments and usually has few other avenues of income. A 20% reduction would prove disastrous and threaten to throw many Americans into poverty. To make matters worse, Americans' life expectancy is increasing and birth rates at the same time are declining. By Social Security's estimates, the number of Americans 65 or older will increase to more than 79 million by 2035. So right around the time that this is set to run out, or at least 2 years after Social Security is scheduled to run out, and 9 years after Medicare Part A, you're going to see a massive jump of likely about 25 million new American citizens added to the 65 and older crowd. Meanwhile, the number of births in the U.S. declined last year by about 4% from 2019, double the average annual rate of decline of 2% since 2014. U.S. birth rates now are at the nation's lowest, below replacement levels. No kidding. So there you have it. There's the story. This is not a new topic, not in the least, because I remember as a kid in the 90s hearing this on, even though I wasn't really paying attention to I was a little kid, but I still remember hearing vividly then President Bill Clinton give States of the Union when he was talking about Social Security running out by the decade of 2030s. He didn't, I forget the exact year, but they were predicting this way back when. And so it's like they've done nothing over the last 30 years to try to correct or curtail this by any way. No major or serious reforms, which is crazy and or insane. So I'm actually kind of used to this. And if Social Security was a flawed Ponzi scheme to begin with, so to speak, again, as I mentioned before, it worked in theory at the time it was introduced because you had the baby boomer generation pop up shortly after the Second World War, and there were numerous kids for every working or contributing to the tax, to the fund, entering the workforce. For every person of the greatest generation, there were at least 4 or 9 individuals who were contributing towards their retirement fund. But again, that generation, then the baby boomer generation, did not reproduce at the same rate. I can probably do a separate video on that, but there is a lot going in. There's a lot going into that, as it pertains to Generation X and Generation Y, aka Millennials, and now Zoomers about to enter into the workforce for the first time, getting out of their indoctrination camps that is called public school system, and realizing, the world isn't exactly what I thought. So there are a lot of factors that contribute to the lower birth rates, but that was already a factor baked in. Now, I would love to know what the situation is like in the UK and Australia as well. I'll do some research to see where they're at in terms of their funding for those who are retired and or disabled. But here in America, it's not looking good. And you've heard the term before how Afghanistan is seen as the destroyer of nations. Any nation that has gone into, or country that has gone into Afghanistan with the attempts of trying to conquer it and or colonize it was destroyed or crumbled within a matter of years. Alexander the Great, the USSR, and here we are just now leaving the war, and we're already projected to at least crumble financially, as it pertains to Social Security and or Medicare, which Medicare especially most troubling because that's just barely a little over 4 years from now, 2026. I can see why Medicare Part B is not yet set to crumble, because that's partially funded by the fact that those who are entering into entering into retirement and eligible for Medicare are actively paying into it with monthly premiums that vary depending on your income. So they have to pay as they go in part. It's also funded by other SMI funds, as well as interest accumulated to those funds, and congressional funds set aside as well, additional congressional funding, but you have that extra funding from the actual premiums, whereas Medicare Part A, and I should probably do a separate video for just explaining how Medicare program works, but Medicare Part A is essentially, however, lacks that additional funding and or source of revenue, because those who are in the United States, if you've worked for 10 years or 40 quarters, you're eligible for Medicare Part A for free, because the assumption is that you've paid into the taxes to help pay for it, even though we all know what you pay into Medicare and or Social Security when it comes time to collect, you're getting back at least 4 times worth of benefits than what you put in. But the idea is because you've worked 40 quarters over the course of your life and or 10 years, you've paid enough to earn it for free. You don't have to pay that extra premium. Unless if you didn't work for 40 quarters, you were a stay-at-home parent, then you're paying an astronomical amount. But that doesn't represent the vast majority of recipients of Part A. So they're lacking that funding because, again, more money gets put out for benefits. More people receive far more money in Social Security and their Medicare than what they actually put in. And so those taxes that were paid into it just were not sufficient for Medicare Part A to stay afloat. Who knows? They may need to start implementing a new premium, monthly premium for Part A as well. So if you're in your 50s right now, you better start preparing. And if you're in your early 60s with only 5 years away from retirement eligibility to receive benefits and or Medicare, you better start planning ahead. Start looking for other ways to generate revenue and or take care of yourself to ensure that you can continue to work a little bit longer for that safety net, because the Medicare or medical costs are set to astronomically increase on you at an alarming rate really, really quick. It's almost like we're in that movie Speed and we're in the bus that cannot go less than 55 miles an hour. You're on the highway, and when you think you're on a clear highway free of any and all traffic, there's a gap in the overpass coming up and you're about to hit it soon. And it's like, what the heck do I do? At least for my generation, millennials, and then obviously Zoomers, we have a whole lifetime to try to figure this out and what to do and what's going to happen, try to save and generate income. And we better start acting and doing that really quick, because that time is going to get here really soon. But what happens in 12 years from now, though, when it completely runs out? Will things collapse? It's just very scary and frightening. So you better start preparing yourself, start looking for other avenues of resources and funds. We may even need to start changing the way we think about our lives and maybe go away from an industrial civilization to more of a, I guess you can say, more of like a farmer-like setting, live off the earth, farming and communal living, so to speak, and everyone working together. That just may be a thought that may have to occur if something doesn't change soon, But again, death of nations, Afghanistan. Are we seeing the beginning of the end? It's just very scary to really think about and or where things are headed right now. So that's the video. I just wanted to make sure everyone was aware of the bridge that we're about to hit, which is really serious. Stay alert, start paying attention, saving money, and also really address these politicians to do something to address this dire issue, especially as it pertains to a lot of these states and or cities instituting a lot of these additional restrictions during this pandemic that is just crippling the economy. We don't need additional help in destroying what funding we do have towards a lot of these institutions. And I may need to do another video on this, but I would love to also know what your thoughts are on this. So I'm a big fan of a lot of also progressive talkers and or YouTubers and influencers who are big fans of universal health care. But given the massive mismanagement that we're seeing right now with the current system that we do have, do you still trust these institutions to run things like healthcare? Given that it's running dry, the resources just aren't there, even with people paying into things like Medicare Part A supposedly over the course of their life through taxes, the funding just isn't there. Does this change your perception at all? But again, that's the video. Let me know what you think in the comment section below. Like this video, comment on this video, share this video, alert your politicians, and don't forget to subscribe to this channel if you're not yet subscribed. This is Bruce the Boss, and I am out. Peace.